All right, brother. Everybody, welcome again back to another episode of Flip the Script. And I am Dr. J. Joey with my good buddy Cameron. And we're going to talk about the second part of the book. We did the part on neck pain, upper back. And so we're going to finish this series out with common sense approach to low back injuries, low back pain, and lower extremity, right? Okay, so what do you got? Don't you have a question for us today, Cam?
Yeah, before I get into the question,
Yeah.
everyone watching, if you'll just go and hit the like and subscribe button at the bottom right of the video, that just helps us out in the algorithm and getting us more views and stuff, so we'd appreciate that.
Give us a leg up.
Yeah,
Yep, I like
absolutely.
that.
Okay, so we do have a question from Tom from Oak Brook, Illinois. He wants to know what supplement brand do you prefer for fatty liver protocol or just for supplements in general?
Oh, fatty liver. Yeah, we did that podcast a couple weeks ago. Well, listen, personally, 90% of my clinical nutritional supplements come from Standard Process and MediHerb. There are a lot of good companies out there, but I've found over the years that these people they kind of set the bar. I consider them second to none. What I like about them is they've been around about 100 years now. Everything's organic, grown on their farms up in Wisconsin, so we know what we got with the quality. But the key thing that really sets them apart for me is that over the past, like I said, almost 100 years, what they'll do is they'll listen to the doctors. And a situation with that would be like the fatty liver disease, where we have a product for liver detoxification. They will listen to the doctor's request for special formulas. An example there would be the Livoplex that I use for my patients with fatty liver disease. They take 5 very powerful liver and kidney detoxification supplements and put them into one formula, one capsule. So this saves my patients the hassle of putting 5 or 6 supplements together in their protocol, which is kind of a heavy load, but it's necessary. So they have streamlined this into special formulas, and they do that with a lot of their products. And again, quality is the key. What I love about a good supplement is that my patients and myself clinically, I can see results sometimes in less than a day, but certainly in a very short period of time. And therefore, I know the quality of what I'm getting, and their standards are second to none. Their quality, the cleanliness of the product, and of course, where they're produced are very strictly managed. So they are my go-to for most everything that I've been using over the last 30 plus years, because of the results that I get. So good question, Tom from Oak Brook, Illinois.
Yep.
Yes, because the product does make the difference. Okay, so we ready to get to low back? Anything else?
No, I wanted to show this visual. I guess I'll put it up here so this camera can see it, but see how there's like the feet and stuff? So I was really interested when you showed me how that 1 foot turning in can kind of cause like a effect all the way up. So if you would just explain that, like, I know I have high arches, and you were saying what happens with the foot when you have high arches. You said it turns in, and then that can go up to the right leg, to the hip.
Okay, so great. So we'll talk, hey, good point. Because when we're looking at the spine, everything's sitting above the feet. So in actuality, a lot of times if the origin of the problem is coming at the feet, then you're defeating the purpose of trying to correct a spinal or pelvic alignment issue if we don't address the feet. Now, like you said, and again, We're talking about the lower triangle today, people. So we're here. We want to keep this, which is the sacrum and the tailbone, and its relationship to the hips. We want to keep that in balance. Again, we're looking at the tailbone, the sacrum, and the hips where they join. All right. So 80% of all back pain, as you're going to read about in my second book, Pain-Free Living. I don't care from the beginning of time, before they had the MRIs and the CAT scans and everything else, doctors knew, look here for the beginning of all these issues. But if we have a foot alignment, our structural problem, then everything above it is going to pay dividends until I fix the foot problem. So that's a good point. So when we're talking about feet, for example, like you said, you have high arches. High arches are great, but with a high arch, you have a arch that has a greater distance to fall if we are what we call either overpronation, which is the most common. We can have a supination where, don't let me get too technical here, but where the weight is on the outside of the feet. Most people tend to break down on the inside. This is where things like plantar fasciitis and other foot-related issues come into play. And if we don't correct that problem, then we're just going to have a reoccurring low back issue, because the low back is going to be more of a symptom associated with something else. And we're going to talk about that here, because that's where most of these conditions are missed, because everybody's treating a symptom. So let's get to that. So if the foot is the problem, I have to customly fit each patient with that problem with their own orthotic. Now, you can buy these in stores, and you find these nowadays. I think you got Dr. Scholl's or something has
the big one,
this where you step on this platform and they have you 3 or 4 different ones that they are already pre-built for you that they consider to be right for you. Doesn't work that way, people. Every patient, every single one, has their own particular change that has occurred in the support of the structures of the bone of their feet. So therefore, I had cast each one of my patients in a standing cast, because you can't get to what we call neutral, doctors, if you're having the patient lay or sit on the table and you're trying to figure out where the neutral is when they cast a foot. You get 10 different doctors, you're going to get 10 different neutrals. When somebody stands, the weight bearing, that is neutral. So in my opinion, over the years, nothing but a standing cast is going to give me the true results. So I have to do that. And everybody, arch is going to drop to a different degree. And once those tendons underneath the arches of the feet, once they stretch, they're not going to go back to their normal tone. It's just, the deal is done. And this can be caused from increase in weight. It's just over the years, also sometimes hard floors and surfaces like that, the excessive stress over time. Running, a number of things. I've been wearing them myself for 20-something years. Okay, but that is the key to stabilizing the low back. So always look to the feet. Some doctors don't like to touch feet. Okay, I tell a good buddy of mine that, look, if you're not going to do it, I'm going to, because how are we going to correct and hold the spinal alignment if we don't get to the underlying cause, literally, which are your puppies, your feet down below. So with that, let's roll into that triangle that we talked about earlier. And the neck and shoulders, we talked about the upper triangle up into the head. So now the next secret is this lower triangle of the pelvis and the sacrum. And if you think about the fact that 8 out of 10 people, like we mentioned before, are going to wind up with debilitating low back pain in their lifetime. So who doesn't this address, right? We also talked about how I told you if you bring in 10 4-year-olds and put them on my table, 8 out of those 10 are already developing a short leg, which I'm going to give you a great example of that, because that just happened, I kid you not, yesterday. Okay. I had a call from a patient. His son, 10-year-old, had strained his neck, had an injury earlier in the day. He's a baseball player, and I think he was just wrestling around with one of his classmates. But he had a game yesterday afternoon. So Sam calls me and asks me if I can get his son in with this injury ASAP. So I had him, sure, bring him down. So Sam's wife brings him down. So, we x-ray the neck and structurally, everything looked fine. So I had the 10-year-old on my table. And while I was there, I wanted to evaluate the rest of his pelvis. Looking at the leg length, his right leg was about a quarter, half inch shorter than his left. So since Mom was there, this was great because I got a chance to show Mom what I was talking about with the pelvic unleveling. Now, like I write about as well in my second book, in my opinion, this is one of the major precursors to a scoliosis. And we talk about the fact they call it idiopathic scoliosis, which means sort of the majority of the scoliosis are idiopathic, which is, we really don't know. We're not idiots, but we kind of, I don't want to say not have a clue, because in my opinion, this is where most of this starts. And we'll talk about how this all comes about. So I explained that to the mother. Now, it turns out, guess what Mom had about 2 weeks ago? Low back surgery for a disc injury in the L4, L5, L5S1. One I don't remember exactly because we didn't go deep into detail. But what was really cool about that is that after we treated her son's neck issue, I explained to her that, again, because she was still experiencing discomfort 2 weeks now post-surgery. And I explained to her that a lot of times these disc injuries are nothing really more than a symptom that something else is going on. And sadly, that's why we tend to see this domino effect with low back disc surgeries, because the underlying cause, in my opinion, is going to be in the pelvis. And so with her, what we did, I said, hey, why don't we just have a look and see what your pelvis is looking like? Had her lay on the table like I did with her son earlier, face down on the table. So Cameron, her right leg was approximately 3/4 of an inch or maybe greater shorter than the left. So what's really cool with today's world is I was able to, I told her son, I said, grab Mom's camera, come over here, grab Mom's phone, come over here and put it on the camera, let's take a picture. So we were able to do that, face down, put the feet together, like we did on the pelvis low back one that we podcast we did earlier. And I was able to take a picture of this and show this to her. And this was kind of mind-blowing to her, but she could see this. Now, of course, on the x-ray, that foot is, when I take an x-ray, standing x-ray, that right leg has to go to the ground. Mm-hmm. So we're going to get that pelvic tilting that I was talking about. And if I can show with the spine what we're going to have with that, again, so her problem was actually here in the SI joint. The symptom was the disc that wound up injuring here, right? So what caused that was that the pelvis on this side simply dropped backwards. Now, that causes shortness in the right leg because the femur, of course, is going to pull up. So when she's gravity neutral face down, I can see the shortness of this leg. So the problem is here. Correct that, because what's going to happen, remember, the spine is going to sit on the top of this tailbone like a vase sits on a coffee table, for example. And if I cut the leg short on the coffee table on one side, gravity is going to have that spine dropping towards that low side. Make sense? Mm-hmm. And like you and I said before, the riding reflex doesn't let us run around leaning towards one side all day. So the riding reflex makes that correction to that lean towards the right side, brings it back to the left, and what does that do to this disc wedge? Well, it's going to open up the wedge on the right side, and that pressure on the left side of the low back, this little nucleus that's sitting in the center is like, hey man, that's too much pressure for me, I'm getting out of here, and it's going to go towards the open space. There's your bulge, which can eventually result in a herniation. Now, is that not really just a symptom for what's going on down here below? So if I balance this out, so like you were saying earlier, how about this domino effect that keeps occurring up, right? So her pain that she was still experiencing was right there in that upper butt cheek on the right side, or right in that area of that SI joint. You could almost put your thumb on it. So it doesn't mean that this did not happen as far as the surgeon's job here is concerned, but did we fix the why for? In my opinion, we have not. So that's why look towards these SI joints. Like before the MRI and the CAT scans, we based a lot of this on x-rays and symptoms, patients' clinical histories. Now, So how'd that right leg get short? That's that question that I get all the time, and I talk about this in my second book. It's almost like, how doesn't it? Because like her son, for example, baseball player, 10 years old, maybe sliding into second base, lands on that right hip, right? And maybe that could be a causation for it. So certainly a fall, something like that. But the most common, think about something as simple as crossing your leg. And this is the thing about Mom. I was watching this in history when I was talking with her son in my office. Because this is what I do over 30 years, especially with women, because they're taught at a young age to cross their legs. It's ladylike. And I was noticing that she was crossing that right leg. And 80% of the time, I'm going to find them that that's the habit that they have, usually when they're giving me a history. They're crossing the leg on the side of the short leg, if you will, the pelvic unleveling. So that's one major cause for women. Well, men as well. And then the other one, of course, is the side sleeper without a pillow between the knees. Because like I've said before, Chris, see if you can keep me in camera here. If I'm sleeping on my left side, for example, here, and there's no pillow between my knees, what has the right knee got to do? Well, it's got to touch the left knee. So if we stood like this, Cameron, for even an hour, you go, no way, I'm not doing it. Like, I'm starting to hurt already right here. So people don't realize that when they're sleeping, which is where you spend 1/3 of your life if you're lucky, that can be throwing the pelvis out. Now, the pelvis is out of alignment. Then we get up in the morning or later in the day and we lift up something off the ground, cause a torque in our low back because of the pelvic unleveling, and what do we have? We got an injury. Mm-hmm. So did I injure my back lifting that weight at the gym or picking up that cooler? No, actually, I injured my back sleeping without proper support to my spine through, of course, the knees, but eventually to the spine. So that's sort of a look at the underlying cause of where these conditions arise from. So that was an interesting situation that just happened yesterday. And what's the chances of that? And now here we are today. We're talking about low back pain and, of course, the balance of the lower triangle.
Would that be considered degenerative disc disease, that what you just explained, or is that something different? Because I know that's something that a lot of people get.
Very commonplace, right? Everybody comes in and, wow, doc, I've got this low back, I'm hurting here. And you read the MRI report, or they'll come in and say, yeah, I've been diagnosed with degenerative disc disease. And sadly, often in healthcare, especially in the medical field, we're basically going to have a disease for everything. Sadly, everything's a disease. I think that's how they have to get paid by the insurance companies. The ICD-10 code has to have some form of disease because that's basically what they treat, right? So I think that's a misnomenclature. The disease that they talk about the discs themselves start to shrink. And that's really more a case of dehydration of the disc than it is actually a disease. How does that happen? Well, the two vertebrae, say you got a vertebra top and a vertebra below, and you got a disc in between. Those vertebrae require movement to feed those discs from above and below. So if we have lack of movement there, and what we know is a subluxation or segmental dysfunction, the disc is not going to get the nutrients that it needs, besides the fact that discs actually love things like minerals and vitamins. C in particular, for example, and of course manganese and magnesium and other nutrients. So if we're not getting those in the soil, number one, we're not feeding our connective tissue, which, in my opinion, look at the number of knee surgeries today, hip replacement. Where were these 50 or 60 years ago? Brother, I'm telling you, my dad, my uncles, they didn't go through that, right? This is another one of our basically starvation to the joints of the body that has created this supposedly epidemic, right? Or this major increase in these surgeries. So getting back to that DJD, what the neurophysiologists have said for the last 20 years is that the key to preventing the degeneration of the disc is to keep the joint in motion. Now that's the neurophysiologist, not the chiropractors. But what do chiropractors do? Well, we manipulate the spine to keep the joint in motion. So see, can we stop? According to the neurophysiologist, you can stop the progression of that degenerative disc disease with keeping the spine moving. Or in the case when I see a lot of these, I say, okay, yes, the damage is there, but let's stop that in its tracks by getting motion back into those spinal segments. And that's how degenerative disc disease clinically or physiologically occurs. Okay, we need more nutrients and we need motion in the spine. And, I think that correlates with spinal motion. You asked me that question about once the curves in the spine and why. Mm-hmm. So we have 4 curves in the spine, one in the neck, mid upper back, one in the low back, and one in the tailbone. These curves are to give us motion, right? So I want you to think of the spine and these curves sort of like a drive shaft in a car, okay? So I don't care who you are, if you're moving correctly when you're walking, your left arm is going forward with the right leg. So this is our natural propel. That's how we propel. And all 24 vertebrae in that spine are affected during that motion. So they're all incorporating you as you walk across the room. So the key to keeping this spine straight, if you will, our drive shaft, can you see where if I have a pelvic unleveling problem and I have a spine that's falling towards one side and I'm increasing the curvature within that spine, I have the way I explain to my patients, I have a bent drive shaft. Now, if my car had a bent drive shaft, I may get from A to B, but I'm going to wear a lot of things out, correct? So the person with the spinal alignment issue, as they're walking across the room, they're going to require more energy and actually probably earlier degeneration to perform such a daily activity as if we kept them straight. So that's one of the reasons for the spinal cord is because it helps to give us the mobility. So if I have 24 segments in that spine and I fuse 2 of them, say somewhere like this patient we were just talking about the other day, 2 vertebrae in the lower back, there's no motion in there anymore. Does that make sense? Mm-hmm. So what's got to happen above and below if all 24 of them are giving us motion? Well, we have to have increased mobility above and below the area that they have fused those 2 segments. What's that going to do?
Yeah, if you fused them all, you'd just be stuck here.
Well, that's right.
And it's like, why?
And then if you did, how are you going to move? So you got to move everything above and below that joint's got to increase its energy and mobility. That will increase wear and tear.
I don't know. I just don't know how anyone ever thought fusing vertebrae would be a good idea. I just don't.
Well,
I mean, if they understand.
Let me tell you, and over my years, some of my best patients, my medical doctors, they come to me, and this is the same story. Chiropractors out there, I know you've heard this one, but this is a story. Hey, man, they come to us. Somebody wants to do surgery on them. Same thing. Boom. They come in, doc, you're my last resort. Sadly, I know this is true. This is. I've heard it so many times. It's kind of mind blowing. We're taught in school not to believe in you, but here I am because I want to avoid that surgery at all costs. Now that just speaks volumes. Sorry. That's it.
That's a good point. If a medical doctor's begging
do something because I know that the prognosis or the outcome is, well, they know. I mean, word gets around, right?
Back pain,
and most of them at all, including, I'm kid you not, I've got some neurosurgeons who've been in my office for similar type situations. So if we can, we want to avoid that. So a good point there. So that's why you're right. No, avoid that at all costs, if at all possible. So again, great topics there with that one. And the key to that is keeping that pelvis balanced. All right. And parents, you can check your children early. I mean, check them early. There's a way I teach my patients how they can do it at home with their kids, right? Just using the bed. There's a couple little key techniques to that, but start measuring them early. I mean, catch this as early as you can before the injury progresses itself. We also talked about how, a lot of these people spend all this money on these sports and their kids at early ages. I'm talking thousands and thousands of dollars. And then they have something like an alignment issue that's creating a knee problem or creating a low back problem that blows out early. It doesn't have to. Let's talk prevention here, all right? A lot of these chronic diseases, well, they started somewhere, didn't they? Let's catch them early. Let's prevent that from happening before it does. So again, short and sweet, dude, right? I mean, it's common sense. And that's sort of what I love about these topics. And that's why the book, Pain-Free Living, my second book, A Common Sense Approach. It's a mini book. And people, honestly, if there was more to it, I would have written you a bigger book. Not to oversimplify, but hey, common sense, reality is where it is. Just a few key things. Keep those triangles in balance. It's a game changer. So, my second book is basically a tool for my patients. So at this time, I don't have it on Amazon. You can find it through my website, www.drjoeyjones.com, or through my clinic, which is Legacy Chiropractic in Hoover, Alabama, 205-985-9888. And I would be more than glad to get one sent your way. Again, I mean, a really easy read. And if it's not, opine and let me know. But hopefully, again, like the cover says, a simple approach. Low back pain.
Yeah, and I can put the link to your website in this video, and then that way, if they want to book, they can just hit the link right there below the video. So if you do want to book, just go down below the video. There'll be a link for his website, and you can get the book straight from there. So,
So, and again, we want to look for the primary causes. And most of the time, you're going to have to look for the structures within the joints. Now, a lot of great things, stretching exercises, they have a key. Massage therapy, great stuff. Here again, though, we're relaxing tight muscles, tendons, and more along the line of the symptoms that occurred basically from the alignment issues, the joint alignment issues and the dysfunction. When a nerve is irritated, okay, that's going to cause a vasoconstriction anywhere that nerve is going, and that's going to create a tightness within the muscle. So if I go in there and I just simply relax the muscle, massage the muscle, and I don't go to the cause of it at that nerve irritation, which is primarily going to be at the nerve root, so wherever it exits the joint, but not always. It can be down in the pathway. I'm going to wind up with the situation or the symptom again in a very short period of time. So the key to releasing the mechanical receptor for a long period of time, shutting down that pain signal, is at the joint dysfunction themselves. So find those, locate those, and then the things that really help to balance and hold that is your exercise, your stretching. And this is something that, those chiropractors, osteopaths, the physical therapists, this is why we get these musculoskeletal problems fixed, where that's our specialty. So a lot of times you're going to find that general practitioner, they don't really have a rotation in the orthopedic aspect, so they're going to have to refer you to somebody anyway. So sadly, with a lot of the insurance companies today, that's kind of the way they send you to the gatekeeper first and then have to pay for the second visit to get to the specialist. So that's where, if you can, nip that one in the bud, get straight to a musculoskeletal specialist for these conditions, because that's neck and low back pain. Structure. Keep the structure in balance. Keep the triangles in balance. That's the key. Again, let's not oversimplify. 30-something years of this, I found that it comes down to those. Everything else is sort of just a symptom, including that disc that my son, that she had surgery for, right? And bless her, she's probably not even maybe a couple years past 40, right? Don't want to start that way. Don't even want to end that way. I don't care. 80
Yeah.
makes no difference. Anything else you want to go over, brother?
No, I got out all my
I know
questions
we got-
on there.
Okay. So, good stuff. And now, there we have it. Upper back pain, lower back pain, neck and headaches, low back, covered. Good point you brought up with the foot. So, everyone, I hope you found something in here. As usual, we hope you'll opine to us with what you think. And again, like Cameron said earlier, hit that subscribe, hit that like button for us. That's sort of how we get to hang around. And if you enjoyed it, please do so. And for myself, Dr. J, and Cameron, another episode of Flip the Script. So until next time, have yourself a great day so that
You're not missing one!
there you go, brother.